Hey, welcome to the clinic.
Hey.
Welcome to the clinic.
Hey, what's up?
Nice to meet you.
You too.
Student Dr. Gary Liu.
Nice to meet you,
Have a
Gary.
seat. Have a seat. What's your name?
I'm Kyle.
Kyle, nice to meet you. What's your last name?
Patch.
Kyle Patch. Good name. Good name.
Thank you.
So, what brings you to the clinic today?
I've been having some pain in my lower back tooth. Yeah, it's kind of recently just been happening, and I'd also like to just get it clean, you know,
Okay.
just check things out.
Okay. Well, I don't know if you know this or not, but the clinic here is student-based. So I'm a student at Western U. So I need to screen you before we can actually look inside your mouth or do any procedures. So I need to screen you to see if you're a proper candidate for our clinic, and also it's a good chance to see if our clinic is good for you too.
Okay.
So does that sound okay?
That sounds good. Yeah.
Nice.
I like that.
Okay, I'm just pulling up your file, everything that you wrote down. So let me take a look. Okay, whoa. Actually, it says you have high anxiety when you come to the dentist. I mean, is everything okay? You look a little bit nervous right now. Your body language is kind of...
Yeah. Sorry about that.
That's okay.
I was having flashbacks. Those instruments right there remind me of dental instruments. Yeah, those ones. Are they?
Oh no, these are instruments I use to fix my air conditioning. Actually. Yeah,
Okay.
They're not dental instruments at all, but they might look like it. But can you tell me more about your anxiety?
Yeah. It all started. I had an experience with this one dentist, and I'll never forget it. And it all started when.
Hi.
Hi, doctor. I don't know. I'm a little nervous about this procedure.
I'm gonna make it as gentle as possible.
Okay. No! Ah! Doctor!
Kyle.
And that's exactly how it happened.
Wow, that sounds pretty terrible, Kyle. And I just want to assure you that we're definitely not having that kind of care here at the PCC. So I just want to let you know that your comfort and your safety is all my priority. I just want to make sure you feel completely comfortable here and safe at the clinic. And one of my goals is to make sure that you feel as little pain as possible. I try to be as gentle as I can, as careful as I can be, so for your health and safety. So if you have any other concerns or anything, I just want you to know that you can tell me whatever you need. It sounds like you have a lot of teeth pulled. Can you tell me more about it?
Yeah, so the first instance, it was due to a football injury, and that was 2 teeth. And then a separate time, a couple of years later, supposedly I had random caries on one of my teeth, and they couldn't salvage it, and I didn't have the money to do anything else besides pull it, so they pulled that. So I guess in total it was 3 teeth. I might have let you on a little bit, or misled you about that, but yeah, it was just 3 teeth total.
Okay, just 3 teeth total pulled. Okay. Well, can you tell me a little bit about the kind of pain you're feeling right now? You said it was the 2 back teeth?
Yeah, I have pain in my back teeth. Sometimes feels like 1, sometimes feels like 2, especially when I'm chewing. I don't know. I really don't want to get another tooth pulled, and I really don't want to spend a ton of money on it. So I'm just wondering, what you could tell me now, what are possible options to treat my tooth?
Okay, Kyle. So from what you're telling me, you prefer to save your teeth, and you're also on a budget, right?
Right.
Okay. Well, for me to assess anything, we'd have to go into the clinic first, and then maybe do some preliminary examinations, take a couple X-rays. Do you know what X-ray is?
Yeah, I've had a couple. They didn't really tell me anything about them, but I've had a couple X-rays.
Okay. Yeah. So the X-rays are going to allow me to better look inside your teeth to see if there's any, caries, rampant caries that you mentioned before. To see if there's any caries in there. I don't know exactly if we have to pull it yet, but if the carie is small enough, we can take it out and put a filling in there to replace that tooth structure.
Can I stop you? What do you mean by caries? Like, is that just like really bad cavity, or is that just...
Oh, caries is basically just, I guess the simplest way to put it is like sugar bugs that are on your teeth. They kind of thrive in a very sugary environment, and then the acid that they produce eats away your tooth structure.
So is that any worse than any other kind of cavity, or is that just
caries, cavities, it's like the same word.
Okay.
Yeah. Any other questions about it?
So what if it's worse than just a regular cavity? What if it's something, I don't know what it could be, but what if it's a worse situation? Like, what other options are there to save the tooth?
Okay, so if the cavity actually gets inside the tooth into what we call pulp, we could do a root canal, clean out all the infected areas, and then fill it with something, and you could still keep your tooth.
Now, is that more painful to have that done versus...
Oh, we can use a local numbing agent, so we could put some local anesthesia in the area, so you wouldn't feel any pain at all. So, yeah, it'd feel okay. In the worst case scenario, we would have to pull a tooth, but like I said before, we don't really know until I get in there and take a look at it and do all the radiographs and x-rays and check out everything. So
okay.
So let me just reiterate some of your goals that you mentioned earlier. So one of the things you said was you wanted to save your teeth, save whatever teeth that you have left. Seems like pain is a really big thing for you. Like you have the dental anxiety. So I'll try my best to minimize the anxiety and the pain. And as for the cost you want to keep costs down, but I'm not going to know how much everything is going to cost or like what we need to do until I actually take a look inside your mouth and do some diagnostic things like take the x-ray and the radiograph. So that would be the next step after this screening procedure is I'd schedule you in for another appointment. You'd come back and then we do the radiographs, take the x-rays, and then I'd look inside your mouth, take a look at what's going on, and then we could proceed from there.
Thanks, that sounds great.
Cool. All right, let's begin the actual oral exam then.
Okay.
Do I have permission?
Yeah.
Excellent.
Not again!
Hey, Kyle. Kyle.
Hey, Kyle. Kyle. Hey, he's not out there.
Sorry about that.
All right, let's get you scheduled in for next week, all right?
Okay, sounds great.
Nice.
Hey, Kyle. Kyle.
But, yeah, let's go forward with this.
Really big.
Oh, shoot.
It's okay. Okay, now get eyes really big. Eyes really big.